Thank you. Good afternoon and welcome. My name is Mark Jennings. I'll be your chair for today's webinar. I am the Chief Solutions and Services Officer for Stratasys, which basically means my role is to shape what we do at Stratasys and how we do it. This is our second webinar in the Thinking Differently series, which aims to bring the best thinking and insight to tackle the problems that need to be solved urgently. The style is to offer a laser-sharp focus on solutions through short, powerful and practical presentations and debate. We have an impressive lineup of speakers and you can find their full biographies on the webpage. Each presenter will speak for approximately 7 minutes, followed by any immediate questions, but we will take the majority at the end. I encourage you to post your questions in the Q&A. Today's topic is unlocking value in healthcare and reimagining productivity through new perspectives. On productivity, we do need to be careful in definitions and to understand both value and waste. Productivity requires a clear definition of value to make sure you are optimizing for the right thing. That is hard for the public sector, and too often the response is a fallback on outputs over inputs in absence of clearly defined value. Luckily for us, we have on this webinar the expert who literally wrote the book on value-based healthcare, so I will leave discussion of this to Sir Muir in a moment. Next slide, please, Carl. No matter the definition, productivity is a significant and broadly acknowledged challenge for the NHS. It is a global healthcare challenge, but pressures feel particularly acute in the UK. I thought I'd better share this graph from the Office of National Statistics on productivity, here being outputs over inputs, over the 26 years leading up to 21-22, but with and without quality adjustment, so that we enter the conversation with an appropriate level set. Of particular note is that the average productivity improvement over the 24 years before the pandemic was 0.8% per year, that's quality adjusted, despite significant technical and medical improvements. For example, minimally invasive surgery was first performed in the UK at the beginning of the 1990s. The decade up to April 2020 was 1.1% quality adjusted. Bear in mind that the March 23 NHS long-term workforce plan assumes 1.5 to 2% productivity growth per year through to 2037 and still sees need for a huge increase in staffing equivalent to adding nearly 1 million net new employees, such is the forecast increase in demand. NHS England will report on productivity and supporting metrics at a national, ICB and trust level starting from the second half of this financial year. So we should have no shortage of data, though we do have a shortage of actual solutions. Next slide, please. For the last 20 years, the NHS has relied on cost improvement plans as somewhat blunt instruments to constrain cost. To be clear, we do see they have a place. Money is finite. To balance budgets short term, sometimes cuts have to be made in year, but short-term cuts cause long-term problems, an unintended consequence. Decades of CIPs have not improved the NHS, and this slide shows some of the reasons why. A topic to explore with our speakers today is whether starting with a better understanding of patient and population need and targeting that need can drive down costs relative to outcomes. Like all good healthcare practice, the treatment plan needs to follow a careful diagnosis. At Stratasys, we talk about productivity prescriptions. Do reach out if you'd like to understand more. For today's session, after we've heard from Sir Muir on value, we will hear from Claire Wilson. CIPs often put CFOs in difficult positions as the people forced into making cuts on behalf of the system. It risks denigrating their role from strategic financial decision makers to bookkeepers. We'll get Claire's perspective on that and on how the system can support the CFO in making better collective decisions. We'll then take a look at how a focus on productivity should pay attention to the productive units of the NHS, the people, and how a holistic workforce strategy helps and empowers them as a route to driving productivity. John will tell us how this is being applied at Alderhay to improve value. Finally, Dilshad, with healthcare CEO experience in Malaysia, Saudi Arabia and Vietnam, will provide the international perspective and how these same challenges are being tackled outside the UK. So it gives me great pleasure to introduce our first speaker, Professor Sir Muir Gray, Executive Director of the Oxford Value and Stewardship Programme, Director of the Optimal Aging Programme and founding director of the Critical Appraisal Skills Programme, plus too many other achievements to mention in the time available. Samir.